day everyone. Today I'm going to demonstrate how to do full bed bathing. I'm Joyce Aquino, your trainer. Okay, step 1 would be for you to do asepsis or proper hand washing. Step 2 is for you to prepare all the supplies, tools, equipment, and materials. And then we're going to observe proper ventilation by closing all air entry. So close the window, switch off the fan and the air conditioning unit. And then, we're going to check the body temperature of the patient. Before using, okay, I have to sterilize it using cotton ball soaked in alcohol, starting from the sensor tip to the stem. Then, insert it on the patient's underarm. Press the button and wait for beeping sound. It's just around 7 to 10 seconds. Then, read the display. It should be normal. So, grandma, your temperature is 36.8 degrees Celsius. After using, we're going to sterilize it again, but this time using another cotton ball from the base to the sensor tip. So remember that whenever you clean or sterilize something, always start from the least to most contaminated air. And then we're going to approach and tell the patient what to do. Hello, grandma. I'm your caregiver for today. I'm going to bed bath you. So it's a form of therapeutic communication. Okay, we're going to put towel underneath the patient's legs. And then spread it out. And do the diamond draping to observe the privacy and to preserve the dignity of the patient by doing the diamond drape to properly cover him. Then we're going to offer the bedpan. Okay, but you have to position the patient in dorsal dependent position. Grandma, would you like to defecate or urinate? And then when the patient's done, remove the bed pad, lower the legs, dispose this properly, and clean it. So why do we have to offer the bed pad first? Okay, because during bed bathing, we're going to be doing a lot of things, okay, that may be involving touching the sensitive parts of the patient. So there are two results. Either the patient could be tickled or aroused. So other way, we have to be preventing disruption. So we offered it before we started cleaning or bed bathing the patient. Then, don't forget to remove the bath towel. Okay. Next is to drape 2 bath towels over the patient's chest. The first towel, the smooth part should be under. And then the second towel, the smooth part should be on top. Okay, remember? The smoother part should be the one touching the patient's skin. And then start with bed bathing procedure. Eyes first. Okay. Make a rectangular hand mitt. And then soak this in soapy water. And then squeeze. Start always from the distal side of the body. So eyes first, distal eye, upper nail from inner to outer canthus, then rinse. Lower lid, inner to outer canthus, and then rinse and do the same on the other eye. Next, for the nose, we're going to do inverted J on the distal side first, from the nose bridge to the nose canal to the tip, then the rinse. Do the same on the other side, figure of inverted J. Nose bridge to nose canal to the tip, and then rinse. Next is the face, figure of S. Soapy water first, circular motion from the forehead to the cheek, to the feel through, to the other cheek, to the chin, down to the neck, and to the back of the ear. Then rinse and do the same on the other side by doing the inverted S. And then we're going to dry the patient's face using the two farthest most corner because these are cleaner. Next is shampooing. Position first the patient in diagonal position. The count of 3, Grandma. I will place your head over here. 1, 2, 3. Then remove the pillow. Place towel underneath the patient's head. And then the bed pad, the belly pad rather, okay, or a shampoo basin. Lift your head, Grandma, the count of 3. 1, 2, 3. And then we're going to put 2 buckets here on this side. Okay, so wet the patient's hair. Then lather shampoo, not direct on the scalp, on your palm first. Then gently massage the scalp and then rinse. If the patient has fuller hair, okay, we can use conditioner, optional only, and not for daily basis. Only for the tips of the hair, not on the roots. And then rinse. Okay, Grandma, I'm going to remove your kelly pad. Raise your head, the count of 3. 1, 2, 3. And then dry the patient's hair by wrapping it in turban style. Okay. When the hair is not quite dry yet, we're going to place back the pillow. Grandma, lift your head. 1, 2, 3. And replace the towel with shower cup, so as to prevent the pillow from being wet. Okay, so to continue, after shampooing, we're going to undress the patient, starting at the strong side or the unaffected side. We position the patient in side lying. Okay, make sure that the side rails are raised and locked before you put the patient in side-lying position. At the count of 3, Grandma, I will place you in side-lying position. 1, 2, 3. And then, untie the patient's love gown.
Go.
And then, put back the patient in supine position. The count of 3, Grandma, I will place you back in supine position. 1, 2, 3. And put the patient's gown on the laundry basket. Then we're going to clean the arm. Distal side first. So we're going to pull the blanket until the patient's waist. And expose the arm. Place towel underneath. And we're going to start cleaning. Okay. So we're going to divide the arm into 2 parts. So this is the anterior side, the posterior, the lateral, and the medial. Anterior first, soapy water from the palm to the brachial area to the shoulder, and then rinse. Posterior from the dorsum to the elbow to the shoulder, and then rinse. Lateral, soapy water from the base of the thumb to the shoulder, and then rinse. Then medial, soapy water from the base of the pinky until the axillary area, then rinse. Next, we're going to clean the patient's hand. Okay, so wet. Lather it with soap. Gently scrub. Emphasis on the interdigital spaces or the spaces in between. Then, brush the fingernails using the pink brush. Remove the dirt under the nails using the orange stick. And then, rinse. And then dry. Always towards the heart. Upward motion to promote normal blood circulation. Cover it and remove the towel. Do the same on the other arm. Next is the chest. Okay, chest, figure of 8. Soapy water first from the middle to the chest area, down to the folds in between down to the folds under the breast, back to the middle, to the chest area, down to the folds under the breast, and back to the middle. Okay? And then, we're going to avoid touching the areola and the nipple. Next is the abdomen. Expose the abdomen. Soapy water first. Okay, distal side for pushing wipes. Okay, to maximize the four sides of the towel. Pinky, palm, thumb, and dorsum. Then rinse. On the proximal abs, we're going to do 4 pulling wipes. Pinky, palm, thumb, and dorsum. Rinse. And then the navel in circular motion. And then dry. Next is the back. Sideline position. The count of 3, Grandma, I will place you in sideline position. So why is it important for you to always inform your patient on what you're going to do next with her or him? Okay? Pag hindi niyo po kasi pinalam, the patient would be much heavier. Hindi siya handa, then it would be more difficult for you to move her or his limbs. Okay? And also to promote or encourage his self-esteem. Okay? Para hindi po siya totally feeling worthless or inutil, then involve him or her. The count of 3, I'll place you in sideline position. 1, 2, 3. And place towel. And expose the back. Again, always start at the distal side. So soapy water first, distal back for pushing wipes. Pinky, palm, thumb, dorsum. Emphasis on the scapula in circular motion, and then rinse. Next is the proximal back for pulling wipes. Soapy water, pinky, palm, thumb, dorsum. Emphasis on the scapula in circular motion, and then rinse. Cover. Then we're going to clean the butt. Again, soapy water. Okay. Distal cheek butt first in circular motion, and then rinse. Proximal cheek butt in circular motion, and then rinse. Emphasis on the gluteal fold down to the anus. Then rinse. And then dry. Remove the towel and position the patient back in supine position. Make sure that the side rail is still raised and locked. At the count of 3, Grandma, I will put you back in supine position. 1, 2, 3.
Go.
To continue, we're going to clean the patient's legs. Okay? So, we're going to place towel underneath. Lift the patient's legs and spread the towel. And spread the legs. Okay. And then when we dried the patient's chest and abdomen, okay, it means that the bottom towel is much wet or more wet than the top one. So we're going to pull this and transfer it on the legs, on top of the patient's legs. And then we're going to pull the blanket beyond the patient's feet. And do the bikini drape. This way, we are going to maintain the privacy of the patient. So, kahit na i-bend mo yung knee niya, hindi pa rin po siya masisilipan. Okay, so just like what we did with the arm, we're going to divide it into 4 parts: anterior part, the posterior, the lateral, and the medial part. So start with the anterior part, from the pedal to the knee to the hip bone, and then rinse. Posterior, soapy water from the sole to the popliteal part to the lower butt. Then rinse. The lateral part. Okay, soapy water from the ankle to the hip, and then rinse. And then medial part. Okay, from the ankle to the thigh, ending at the femoral or the groin area. Then rinse. Next is the foot. Okay, so wet, lather with soap, gently scrub, emphasis on the spaces in between, brush the toenails using the pink brush, remove the dirt under the nails using orange stick. And then rinse. And do the same on the other leg and foot. Then dry. Next, we're going to clean the genital part. Next is perineal care for the female patient first. So, we're going to do the diamond draping. Then, the bed part. Position the patient in dorsal recumbent. Insert it. Raise your hip, grandma, the count of 3. 1, 2, 3. Okay. And then we're going to put the rolled towel under the patient's hip kasi elevate ito, no? Nung siliksik na yung bed pa. 1, 2, 3. Are you comfortable, grandma? Then proceed with perineal care. Okay, first, wet the genital. And then prepare a mixture of water and feminine wash. 7 strokes. Okay. In real life, you should remain covered. Okay, for the patient's privacy. But for demonstration purposes, I'm going to expose this. Expose it so you will know what I'm going to do next. Okay, so 7 strokes. From the mons pubis down to the labia majora, disposed. So the same on the other side, mons pubis down to the labia majora. So that's 1 and 2. Next for 3 and 4, okay, from the mons pubis down to the fold, in between labia majora and labia minora. So we're going to spread the labias. Okay, do the same on the other side. Spread the labias. Next. Okay, number 5 is from the mons pubis to the clitoris. Then clitoris down to the orifice of the urethra. That's 6. And lastly, from the orifice of the urethra down to the anus. And then, rinse. Okay, for the male patient, okay, again, it should be remain covered. It will remain covered, but for demonstration purposes, we're going to show what we're going to do next. Okay, using a separate washcloth for the genital only, solely for the cleaning of the genital, we're going to soapy washcloth. Okay. 7 strokes as well. Okay. First, 1 and 2 from the scrotum to the anus, then rinse. Next, and then the shaft. Okay, you're going to hold it and then wipe the 4 sides in one direction only. Upward motion. 1, 2, 3, and then 4, and then rinse. And then we're going to retract the foreskin, especially if the patient is uncircumcised, to clean the tip or hole. And then rinse. Remove the bed fan and the towel. Grandma, lift your hip. 1, 2, 3. I will remove your towel. Cover the patient with a blanket and remove the remaining towel. And then put this in the laundry basket. We're going to remove as well the patient's shower and the patient. Then we're going to dress the patient, but this time starting at the affected or the weak side. And position the patient inside lying so we can tie the patient's gown. At the count of 3, I will place you inside lying position. 1, 2, 3.
No.
And position the patient back in supine position. The count of 3, Grandma. I will place you back in supine position. 1, 2, 3. Okay. And then we're going to check the vital signs of the patient. Okay, do post-care and hygiene and grooming procedure so we can dye the hair. We can put powder on her face if she wants to, and then lotion on her skin. And wish the patient good night. That's it. Thanks for watching. Hope you learned something.